Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. In a previous episode, I discussed in depth what atrial fibrillation, or AFib, is, how it is diagnosed, several possible causes and useful treatments to bring the patient's heart back into regular rhythm. In this episode, I will briefly review AFib and describe a popular and effective treatment called Catheter Ablation. Don't forget to click the subscribe button as well as the bell to be notified of upcoming videos. So let's get started. So what is AFib? AFib is a type of irregular heart rhythm. During AFib, the atria, the upper chambers of the heart, quiver chaotically, resulting in an irregular and often rapid heartbeat. The heart's rhythm or beat is caused by specific nerve bundles located in specialized cardiac tissue that regulate the normal rhythm of the heart. One critical result of arrhythmia is the prevention of the heart to pump blood throughout the body, resulting in a decrease of nutrients to the rest of the body and increasing the risk of stroke and heart failure. Before going further, let's look at a portion of the heart's anatomy. The heart is divided into 4 chambers: right atrium, left ventricle, and left ventricle. The 2 upper chambers are the atria, separated into the right and left atrium. The right atrium receives deoxygenated blood from the body by way of the superior vena cava and inferior vena cava. When the right atrium fills with blood, the tricuspid valve opens and the blood flows from the right atrium to the right ventricle. The blood is then pumped by the right ventricle to the lungs, where it picks up oxygen and releases carbon dioxide. The oxygenated blood returns to fill up the left atrium. The mitral valve opens and the blood flows into the left ventricle and then is pumped out to the body. This is diagrammatically shown in panel A. The diagram on the right traces the electrical path responsible for normal heart rhythm or heartbeat. The cardiac cells located at the sinoatrial node or SA node depolarize or fire, sending an electrical signal to the AV or atrioventricular node, resulting in contractions of the atria. That signal is then carried throughout the bundle of His and other nerve bundles, causing the ventricles to contract, resulting in the pumping of blood throughout the body. One result of irregular signaling from the SA node is atrial fibrillation. If a primary cause of the development of AFib is related to an underlying health condition, treatment of that condition by proper medication would be part of the treatment regimen. There are a host of medications and medical devices that can be prescribed to maintain normal heart rhythm, including pacemakers, beta blockers, drugs that regulate rhythm, and of course blood thinners to reduce the probability of a stroke. Electrocardioversion is a procedure in which an electrical current is used to reset the heart's rhythm back to its regular pattern. Electrical cardioversion has a high success rate, but it is possible, depending upon the individual, that AFib may return and require another shock treatment. A catheter ablation is most often done using a thin, flexible catheter inserted in the heart that uses heat or cold energy to create tiny scars in specific cells in the heart to block abnormal electrical signals, thus restoring normal heart rhythm. This procedure also has a very high success rate, but also may require additional procedures, once again depending upon the individual. Surgical ablation removes a layer of the heart tissue to block abnormal electrical signals to restore a normal heart rhythm. Remember, not all AFib sufferers experience symptoms of heart arrhythmia. Also recall that as one ages, AFib occurrences increases dramatically. That is why individuals 65 and over should request that their annual physical exams include an EKG. And if there is a familial cardiovascular history, a 65 or older individual should become a patient of a cardiologist. There are three categories that a cardiologist places a patient suffering from AFib, and that placement is determined by the frequency of AFib that the patient experiences. Paroxysmal represents AFib that comes and goes and lasts 7 days or less. Persistent is AFib that lasts longer than 7 days, while long-lasting occurs over a long period of time. A general cardiologist can refer the AFib patient to an electrophysiologist, who is a cardiologist that has additional training and can insert pacemakers and are also trained to perform cardioversions and catheter ablations. So what is a catheter ablation? It is a procedure that scars cardiac cells and tissues to block abnormal electrical signals that are causing the patient's irregular heartbeat. This technique is a safe, minimally invasive tool and restores normal heart rhythm. This procedure is usually provided to AFib patients in their paroxysmal and persistent AFib categories who have not responded well to cardio medications. Patients in these categories usually respond positively to catheter ablation. Those patients in the long-lasting category may receive medication, cardioversion, and catheter ablation but respond less well to these treatments. This slide shows the area of the heart that is generally misfiring, resulting in the presentation of atrial fibrillation. The left atrium is the anatomical structure where the misfiring occurs, and that misfiring usually occurs in the cardiac tissue surrounding the pulmonary veins that are bringing oxygenated blood to the heart for eventual distribution to the rest of the body. This feature is diagrammatically presented in Panel A of this slide, and a magnification is depicted in Panel B. The yellow stars represent the cardiac misfiring cells of the heart. A catheter is inserted into the heart via a blood vessel in the wrist or leg. A small needle is used to make 2 holes in the septum to allow passage of the catheters from the right side to the left side of the heart. Before the ablation, electrical mapping of the heart is performed. An electrically sensitive catheter is used to map the heart muscle and the origins of the electrical activity throughout the heart. The results of the mapping presents the surgeon with a visual representation of the areas of the heart that are functioning normally and those areas creating problematic electrical signals that interfere with proper rhythm. The development of these electrical sensitive catheters and the associated computer imaging software have advanced this procedure during the last 10 years from a last resort tool to a first-line tool to treat atrial fibrillation. The electrophysiologist carefully destroys malfunctioning tissue using a catheter to deliver energy such as radiofrequency or cryotherapy to scar the problematic areas. The scarred areas will no longer send abnormal signals. Catheter ablation for AFib often follows a predictable pattern. The areas around the pulmonary veins are a common culprit, and the ablation will target abnormal cells that start around the pulmonary veins. Catheter ablation is usually successfully done on patients with paroxysmal and persistent type of AFib when medication doesn't work. Catheter ablation patients are usually taken off of a blood thinner and antiarrhythmia drugs after the procedure. Catheter ablation appears to be an effective early treatment for AFib. Some ablation patients require multiple ablation procedures. Don't forget to subscribe and ring the bell to be notified of my next video on science and other stuff for senior citizens. Bye.